Okay, and then I'm going to screen share. Hello, hello. Oh, let me get back to the beginning of my presentation here. Good deal. Thanks for being here, guys. Welcome, welcome. We're going to hop right in and get started. Also, I know there's going to be some watching the recording later, so welcome if you're watching the recording. I love to have interaction, so if you have questions and comments, feel free. I'll pause a couple of times so you can unmute for those of you who are here live, or you're welcome to post in the comments. And I'd love to know in the comments where you're joining from. I think everybody's my local people here, so all in Washington tonight. So thanks again for being here. I'm Angela, and we are going to talk tonight about a health share, which is an alternative to health insurance. And it's a partnership with my company, Young Living and Clearwater. So I started learning about this in July of 2024, about 6 months ago, and have really seen a lot of benefit from my family, and that's why I've started sharing it with other people. So I'm going to just get right to it. My goal is to keep this less than 30 minutes. Respect your time. I know for a lot of you, it's family time, dinner time, that kind of thing. So I'm going to get to it and hop right in here. So first thing I want to talk about is who is Clearwater? So Clearwater is a healthcare company that offers a health share and a variety of different options for healthcare. It is a nonprofit company. It was established in 2018, so 7 years ago, and it's a option. They offer an option that is different than traditional health insurance. One of the big things is that it makes them different is that they're a nonprofit. So most insurance companies are for-profit businesses, and their goal is to make millions or billions of dollars. And a lot of times that is at the cost of us, the patient or the person who needs health care or who needs coverage for something that's going on. The benefit with Clearwater is that you can be in control of your decisions and your health care, and I'll share a little bit more about that on the next couple of screens, but it makes things so that you're in control. And the goal with it, and the reason that Young Living partnered with Clearwater, is to really disrupt and change the healthcare industry so that people can be more proactive with their healthcare and get the services that you need when you need something. And then let's talk a little bit about what is a health share. So it's a community of individuals. These have been around for 20 years at least, maybe longer, but it's a community of individuals that pay a monthly premium to help cover the medical costs of everybody within that group. So the money is shared. It's a pool of money that's put together to help pay for those costs. And we pay as a member, or when we sign up for it, we pay a monthly premium, and then we have annual max. And now, if you've had traditional health insurance, you might be familiar with or have heard of a deductible. So, a deductible is the amount that you're 100% responsible for before your health insurance kicks in. And then you have a max out of pocket. The max out of pocket, then after your deductible, is somewhere around $10,000 or $15,000, depending on your insurance. Sometimes they're less than that, but that's where your insurance is going to share the costs. So they might pay 80% and you pay 20%. That I think is one of the most common ways that it's split towards that annual max. Once you have spent that annual max, then insurance kicks in and would typically cover 100%. The difference with an annual max and not having a deductible with a health share is that whatever amount it is that you choose, you cover 100%, then they kick in 100%. And they're pretty low. 1,000, 2,500, or 5,000 are the amounts that are offered. I think that this year we're going to have more that are larger to help people have even lower monthly premiums, but those haven't been released yet. I've just heard the information that it's going to be coming. And then 100% is covered after that amount that you choose for your annual max. So again, it helps to have that be something that's lower compared to traditional health insurance. So this is a screen that is really good to kind of give you a comparison. Again, like I talked about, the health share is a non-profit. And so if you're familiar with nonprofits, what that means is that they can't make a ton of money. There are limitations on how much they can make and still have that classification. So again, they're not making millions or billions like traditional health insurance. The goal is to put the money towards the services that we need as members to keep costs low. And then they're covering their overhead costs of the organization. Obviously, there's employees and staff and buildings and that kind of thing, your traditional business costs, but they're not making a ton of money after all those costs are covered. Um, a nice benefit is that it has an open network of providers. So you don't have to look up a list of doctors. If you are going to a licensed physician or provider for whatever it might be, so if it's chiropractic or if it is a medical doctor or a naturopath, that is, you can choose anyone and they are all covered at the same amount. So naturopath and acupuncture are two providers that you can get services from with this, and that's usually something that is not offered or covered on traditional health insurance. So a big difference in those two categories. Deductibles, I kind of already explained that. With traditional health insurance, you're used to having a deductible, then a max out of pocket. And with this, it's only one pool of money that is your responsibility to start with. Another thing with the health share is that claims are rarely denied. They want to keep us happy so that we stay and help contribute to the pool of money for everybody, again, keeping costs down and helping them grow. One of the things that I'll explain on a future slide is that there's major medical coverage, but then there's also holistic coverages that you can get. When you get the holistic coverage, there isn't a annual max for those services. So a chiropractor is a holistic service and you can choose either 12 or 24 visits per year per person on the plan, and it is a set amount. So you pay for the visit and then you get reimbursed everything except for the first $35. So it's like having a $35 out of pocket cost or deductible when you go to a chiropractor. Makes it very cost effective and very affordable. And then it puts healthcare decisions back into your hands. Again, you are able to go to any doctor and be totally in control of that. Now, on the other side, comparing that to traditional health insurance, premiums are high. They're increasing significantly. Clearwater hasn't had an increase for 2 years. With health insurance, again, it's a for-profit business. You're limited to a list of providers that are approved or have a contractual agreement with the health insurance company. Um, you have deductibles and co-payments and max out of pockets. So lots of things for to know and understand on what your coverages are. And there's a lot of denials. I've talked to multiple people who have had situations that were denied, and as long as you don't have pre-existing conditions, then the health share is very good about covering things. So that's something that if I've given you the little questionnaire that I have, that's one of the things that I ask. So like if you have cancer or you've had cancer treatment within the last 60 months, you wouldn't be a good fit for the health share because that would be considered a pre-existing condition and that condition would not be covered. And then traditional health insurance is regulated heavily by the government. And then the health share, again, it's a nonprofit, is not something that is regulated like traditional health insurance. This is my family's comparison. So it's based off of age. And if you're single, if you're just husband and wife or spouse, and that it also, if you're cohabitating, you don't have to be married to be covered under the same plan. And then if you're a family. So for us, we're in our 40s. There's four of us, and on our health insurance, we were paying just over 1,500 a month, so 1,560. And now with the health share, we have more coverage and it's only $955 a month. So a couple of other comparisons. Chiropractic visits went from 12 per year to 24, and we are now covered to go to acupuncture. So when I was pregnant with my son, he was 10 days late, and I went to acupuncture, I think it was 3 or 4 times. Pretty sure it was three, to try to get things ready and get him moving along to make his exit. And I paid cash out of pocket for all of those because my insurance didn't include acupuncture. I think it was $155 per visit. and that this would have been covered with that. And so it can make a really big difference for a lot of people. Something that is included is IV drips. That's part of the holistic plan as well. Telemedicine is included. That's something that's typically included with health insurance. Like you can call a nurse line. The difference is with this is that you can actually talk to a physician. So it kind of depends. A lot of things have changed since COVID. So that one is typically pretty similar with the health insurance versus a health share. Um, Telehealth for mental coverages is free with the health share. That's not something that we had on our health insurance and typically isn't part of health insurance. But one of the things that I love because of the partnership with Young Living, my company, they actually cover supplements. So it's a supplement purchase of $75 per month from Young Living. It's up to $75 for a family. For individuals, it's $50. But for my family, we're already buying that. Obviously, I've been using Young Living products for 10 years, and we were already buying more than that every month. So I like being able to get reimbursed and help that be covered. Again, all of that while I'm saving $600 a month, a little over 600. So it's pretty awesome for my family. So again, as I kind of mentioned briefly, there are different types of plans that you can get. So ClearShare, this is for major medical coverages. And this is for like if you're in a car accident and you need to go to the emergency room, or you break a bone, or you need a surgery like a knee replacement or a hip replacement, something like that. Those are the medical types of things. Holistic is the chiropractor, acupuncture, the IV drips, those holistic preventative things. Now, anybody can get the holistic preventative things because it's very clear of what's covered and what's not covered that you sign up for. And I have that on a slide here in a minute. So somebody who has a pre-existing condition can still get the holistic coverage. They can't get the medical coverage. Somebody who's over the age of 65 can also get the holistic coverage. Now, most people over 65 are going to have Medicare. And so this would be like an add-on. They wouldn't, or like a, in addition to, so they wouldn't need to get other coverage. A lot of people will do that. I think one of the more common ones, drawing a blank of what the insurance company is called, but Humana, I think is what it's called, that they'll get for like their add-on. That's pretty common for Medicare, but this is very good and super cost effective, giving people a lot of better coverages that they don't even have typically with those others. And then the third option is for people to get both the medical coverage and the holistic coverage. Does anybody have any questions at this point? Okay, go for it, Nikki.
All right. So is holistic plus ClearShare a good plan when you know, yeah, I want all my natural stuff, but I also want that backup plan for the what ifs? Is that a good
Yes,
option? Okay.
absolutely. Absolutely. That is typically the best option for that. And if somebody has a comfort level to have a higher out of pocket, so again, you're healthy, you don't have any known concerns or anything that you would expect to need help with, then you can sign up for the $5,000 out of pocket, and then have like a savings account or a credit card that is in case there is an emergency, you can cover the first $5,000 so that you can have the lowest monthly premium possible. It's usually what I tell people. My family, as you saw on the last screen, we signed up for 2,500 and that, but I make sure that we have that in a savings account so that we're covered if anything comes up. What's covered? Lots of things are covered. And so I like to point this out. Again, there's no network. You choose the physician that you want to go to. If you have an accident, if you need to go to the ER, hospital services, you can go anywhere. Telemedicine, again, that's 365 days a year. The mental health sessions, $0. Care coordination. This is a specific department at Clearwater that helps you. Let's say you need a surgery. They will help you to look at the different options in the area, help you find a physician if you want or need one. And if you use the options, one of the options that they give you, then it actually waives, they will waive your max out of pocket, that annual max of, again, 1,000, 2,500, or 5,000 for that procedure when you use their recommendations. And they're going to give recommendations of what's in your area, what's available to you, and simply show you what it is. But they want to make sure that you're really examining and looking at it to save as much money as possible. So for example, there was a gentleman who needed a hip replacement surgery. He had went to his doctor, and his doctor was going to do it at a hospital. The cost for it was going to be $80,000. He contacted the care coordination department, and they discovered that his same physician does the surgery at a surgery center, and the cost there would be $40,000. So he had the $5,000 plan. And because he chose to have them scheduled at the surgery center and save the group as a whole $40,000, because it's essentially half price at a surgery center, fewer costs and things, then he didn't have to pay anything out of pocket. It was waived for using that option. So it's a huge benefit to us when there is something that's planned and can help save the overall organization money. Pregnancy and postpartum is covered as long as you're not pregnant at the time that you sign up. Hospital birth, birth center, home birth, wherever you're going to give birth, all is covered. Home health care, pain management injections, hormone therapy injections, medical supplies, nutrition services, international medical treatment. So this one is a big one. If you have health insurance and you travel outside of the United States and something happens, it won't be covered. With this, it will be covered. So, like, let's say you get the flu or food poisoning or whatever it might be, and you need care, it will be covered. You would pay for it, you'd get a receipt, and you'd get reimbursed. Now, if it's something significant, then you can get them involved to help pay for it from the front. But if it's something that's, $500 or $1,000, then you could get care and get that reimbursed and taken care of for you. Occupational therapy, physical therapy, speech therapy, massage therapy, inpatient or out-of-patient hyperbaric therapy, medical equipment, so durable medical equipment, skilled nursing facilities, hospice care, and weight reduction. So a very wide variety of things that are offered and available. The only thing that I have had anybody ask about that isn't covered is oh my gosh, I'm drawing a blank with words tonight. Maybe I'm still a little jet lagged from my trip out of the country. Um, when you can't get pregnant, I can't think of what the word is, but if you are wanting to go and have those services, those are not covered. Can somebody give me the word? Like, why am I drawing a blank? I don't even know what I'm trying to think of.
So
Um,
infertility,
Infertility, thank you.
okay.
Yes. That is not covered. That's the only thing that I've been able to find that somebody has asked me about. So it's a good one to know. Um, Next, let's talk about the specifics of what is covered under the holistic. So as I mentioned, the holistic is separate, and you don't have your annual max that is for this. So the essential oils or supplements from Young Living, $50 for an individual or $75 for couples and families. Primary care visits covered under the holistic side. Again, you can see on the list over here on the right, there are a wide variety of doctors. So you can go to naturopath, you can go to a doctor of osteopathic medicine, very wide variety. They cover up to $150 per visit, and then your actual out of pocket would be $20 at the end of that. Breast imaging, again, this is a really nice thing when compared to traditional health insurance, is you can go obviously get mammograms that are covered. But if you don't want the radiation exposure, thermography is actually covered through the health share. So that's an option for a lot of people. I did that prior to having this, and I went a couple of times. And the first time, I think it was like $599 out of pocket. And then the second time for like a recheck was, I think, $399, might have been $299. But again, totally out of pocket. My insurance doesn't recognize it, or didn't, and it didn't cover it. So I paid for it 100%. And then chiropractic visits. As you guys saw on my family's comparison, we doubled our number of chiropractic visits we get in a year. And it's a combination of chiropractic and acupuncture. So for us, we did the plan where we can get 24 visits, and it can be 23 to the chiropractor and one to the acupuncturist or any mix. It doesn't matter, but it's a total of 24 visits. We pay $35 is our final cost for that. And they pay up to $175 per visit. So this is a really big deal. And I want to share this because previously it was just straightforward chiropractic adjustment. I paid $40 per visit, and other things weren't covered. But this covers add-ons. If you go to a chiropractor who offers massage, you can get a chiropractic adjustment, you can get a massage, you can get red light therapy, you can buy supplements from your chiropractor. I buy a a supplement LMNT that has like minerals in it. It's good for electrolytes and that. And I buy it by the box there, and I pretty much buy it every time either myself or my husband goes to the chiropractor so that we have a good stock of it. And it's I think it's $60 a box. It gets 100% covered because I've already paid for my chiropractic visit. So it's a really nice feature. So depending on other services that your chiropractor offers, you can get a ton of benefit out of this. Again, that traditional health insurance isn't going to cover in most cases. So I love that. And I want to explain a little bit about how the holistic services work. So when you go to your visit, you pay cash. I have money set aside, and I have a separate account where money is where we have our $2,500, and we pay for anything and then get our reimbursements. So if I go to the chiropractor and my visit for my adjustment plus my add-ons, say is $110, I pay $110 to the chiropractor, I get a receipt, and then we have an app through ClearShare or Clearwater that I upload that to. I confirm my name, the date, upload the image, literally take a screenshot on my phone from the email that I get for the receipt and upload it and then get reimbursed. Typically, reimbursement is 3 to 4 weeks. They got a little bit behind at the end of the year, and right now it's about 7 weeks. So I haven't heard an update of in the last like 2 weeks. It was the end of December when I got the last update. So I like to share that as well, that the reimbursements are taking a little longer than expected and normal, but you still get reimbursed. And I get it reimbursed right into my checking account. Again, it's that same account I have set up for medical stuff, and everything comes and goes out of that account. Then IV drips, it shows how that is. It's one per month, so you'd get 12 per year. Um, and a nice way to be able to get liquid supplementation to boost your wellness and that. And then generic prescriptions are covered 100%. And if it's a name brand, then it depends on the brand. So there's not like a price list on that. That would be something that you would have to have checked on the pricing. Then the holistic savings. So the first one we looked at was the full holistic plan. Holistic savings is a little more cost-effective option. I'm going to pull up the price in just a few minutes, but this allows you to have um, fewer things. So the chiropractic visits is 12 per year. So chiropractic and acupuncture. It doesn't include the breast imaging. It doesn't include the IV drips, and it doesn't include the prescriptions. So a more cost-effective option on that. And so here, this shows the plan pricing. So as you can see across the top in the yellow, there's the annual max. So depending on, again, what you're comfortable covering, if you have a major medical situation, 5,000, 2,500, or 1,000. And then on the columns as you're going down, you look at what's your age group. So if you're 18 to 29, 30 to 39, 40 to 49, or above 50, then it shows you those options. And then you go across to see what it is based off of being single, married, single with kids, or family with kids. So again, for my family, we fell into the 40 to 49, family with kids, and we did the 2,500. So we did the it would be 560 if we did medical only, because this one is clear share only, so it's a medical plan only on that. So as you can see, I mean, if it's somebody who's younger, significant difference in the monthly premium versus the older, because again, when you're older, you're more likely to have something go on and that. But again, super competitive and really good pricing compared to traditional health insurance for almost anybody and that. So the next is holistic plans. So this is if you're looking at the holistic option, again, if you're single, you're married, or if you have a family with kids, or if you're over 65 years old or you have a medical condition, this is really great for those situations. And now here's the combination. So the holistic savings first, combined with the medical coverage, if you're looking for both. Give it a pause if anybody has any questions or wants me to read out loud any of the categories, because I know if you're hard and or if you're on your phone, it's hard to read or zoom in, but you can take a screenshot so you can zoom in and save it later, or you can again unmute and let me know if you want me to tell you one of the categories.
So, Angela, for family with kids, does that mean you are choosing to have your kids on the plan? So, my
Correct.
kids are adults. So, like
So,
one may need it, one may not, one may have it at work. And so I don't need to specify how
correct.
many kids, just with kids, or how
Correct.
that works.
Yeah. So yeah, if you have 2 kids or 7 kids, the price is the same. So
Okay.
it's again that is for people who are larger families, that's a nice benefit. Um, but I mean, if 1 or 2 kids type of thing, then it's not necessarily as big of benefit or savings. But yeah, and if you have kids that already have their own coverages, even if they live at home, you don't have to cover them. I even
Yeah.
have a couple of people that with a husband and wife. The husband had a plan that's okay-ish through his work, but it was really expensive for his wife to be added on. And so she carries the plan. She actually does the holistic and clear share for herself only. And so that's something that's a really nice option, super flexible with that. So this one is the holistic with the medical. So the clear share. So this is the full holistic. If you want the 24 chiropractic and acupuncture, you want the breast imaging, you want the IV drip option as well.
Okay, hold on a second.
Uh-huh.
What was the sheet just before this?
It's the holistic savings. So that's
Okay.
the option where you go to have chiropractic and acupuncture only 12 times a year.
Yes. Okay, got it.
The more basic option for that one.
Okay,
Cool.
I'm ready now.
Awesome. Okay. So then family annual max. I like to point this out. So if you are going to be covering a family and you sign up for the 1,000, it's 1,000 annual max per person up to 3 people. So if you're the only person on there, it's $1,000 straightforward. But if you have children or a spouse, then you'll see the different tiers of what is in there. So I wanted to make sure I pointed that out. And again, the annual max is for the medical types of coverages. If you have an emergency room visit, if you're in the hospital, you have a surgery, something like that. So those types of services, not the holistic services. Any questions on this? Okay, cool. Vision and dental. This is something that's an optional add-on. For my family, I did the vision, but I kept my other dental because my other dental was about, I think it was $17 a person per month. And so it was pretty cost effective. And we have good coverage. I like my dentist. So I just didn't change it type of thing. So pretty simple, but you can do them as individual or you can do a combination of the two. And it kind of shows what that looks like for the plans and the dental coverages and stuff. So how does it work? Like I mentioned, Clearwater is the company that administers the plan. So when you enroll and you set up an account, you first set up a Young Living account so that you can qualify for the discounted group package rates that we went through, all those screens that were the different options. But you pay Clearwater for the plan and everything goes through them. Your reimbursement comes through them. If you need any support or help, it comes through them. But then your product reimbursement, obviously, it comes from them, but you would purchase that from Young Living and get your products there on the Young Living website. So it's specifically that receipt that you get reimbursed off of. It's super simple. When you're ready to sign up and enroll, if you want coverage to start on February 1st, you can enroll anytime before February 1st. You need to enroll on January 31st. I think it's by like 5 p.m. our time, to make sure that everything is in the system and that it looks good. But you sign up, coverage begins on the 1st of the next month, and you make your first payment on, it's like the 9th or the 10th, that it comes off of either your credit card or your checking account that you enrolled with, and then you start submitting receipts. So you go to the chiropractor or anything that you do. If you have a medical situation, again, you submit those. And so I really like this because you start having the coverage and the benefits and seeing providers before you've even made your first monthly, premium payment. So I really like that, that they are getting coverage and everything beforehand. And then that's me. That's what I got. Look at that, 7:31. I kept it to 1 minute long, but it get pretty good. So this is my contact information. So if you have any questions, you're welcome to reach out to me. And obviously Facebook message, or however it is that we have already chatted and talked with each other. But does anybody have any questions before I stop the recording? You guys are awesome. Thanks for being here. I appreciate you, and I will check in with each of you tomorrow or next week to see if you have thought of any questions since this ended, or if you need any of the information sent and shared to you. I'd be happy to do that. So thanks for being here, and we will talk to you guys soon. Have a
Thank
good
you.
night.
I have a
Thanks,
real
guys.
quick question.
Oh, yes, go
Did
ahead.
you want me I went in the other room. My son is like, for the when you're paying the providers, I am currently with a different MetaShare. It's MetaShare. It's
Okay.
like kind of similar concepts.
Yes.
They negotiate like rates with the companies. Is that something similar, or are you getting like the cash price, or how does that work?
It is the cash price. I'm not aware of any like negotiated rates that are discounted rates or anything with providers. So it would be the cash price. Good question.
Yeah, that's been definitely a when I've had to go to the doctor. I don't go to the doctor very often, but when I've had it, it's hard to find the provider. So that was one of the things I that was a big takeaway of that you don't have to go within that network, because I couldn't tell you how many places I called that were on their website, and I was like, they don't take it anymore, or different things like that for the
Really?
other.
Oh, wow.
Oh yeah,
That's interesting.
and it was
And
yeah,
that's through MetaShare.
yeah. I
Okay.
I definitely called them and told them. I was like, this is ridiculous because I've been a member there for I don't know, 6 years or something like that, and I have a
Yeah.
$10,000. I just use it as a if something bad happens. But
Right.
I I needed to go to a doctor. I had a cyst, and so it was very painful. And I was just like, I just need to go see a doctor. But I did end
Yeah.
up finding a so, um, but awesome. Thank you so much.
Yes, you're welcome. Thank you for being here, and good luck over the next few days. I'll be thinking about you guys and praying for you.
Thank you. I appreciate it.
All righty. We'll talk soon.
Bye.
Okay, bye. Awesome.
You did
Thanks,
great.
guys.
Thank you so much.
Thank you. I appreciate you being here.